15 years of service. More than 40 doctors. The SIHHA Medical Center, Dammam. Quality, affordable healthcare.
Finding out you have diabetes can be scary, but don't panic. People with diabetes can live long, healthy lives. Sure, let's go over some basics. This is diabetes. Made simple. When we eat, food travels to the stomach. Food is made up of 3 basic nutrients: carbohydrates, proteins, and fats. During digestion, carbohydrates are broken down into sugar, otherwise known as glucose. Here's a quick fact. Carbohydrates include foods such as bread, rice, pasta, potatoes, fruit, milk, and yogurt. In a normal digestive process, sugar travels from the stomach, through the bloodstream, to your body's muscle and fat cells. However, sugar can't enter these cells without the help of a special hormone called insulin, which is produced by the pancreas. Insulin acts like a key, unlocking the doors to the muscle and fat cells and allowing the sugar to enter. The cells then use this sugar as fuel to provide energy for the body. When this process is functioning properly, sugar entering the bloodstream from the stomach is able to exit the bloodstream at the muscle and fat cells. In this manner, the body is able to regulate the concentration of sugar in the bloodstream. Now let's see what happens in a person with diabetes. Sugar enters the bloodstream, but one of 2 things happens. Either the pancreas does not produce a sufficient quantity of insulin to match the sugar entering the bloodstream, or the body cells do not respond to the insulin that the body is producing. In both cases, the result is the same. Cell doors remain closed, causing sugar to get backed up in the bloodstream. As a result, blood sugar levels rise. This creates several problems. Because sugars are not able to enter your body's cells, your body is not getting the fuel it needs. As a result, you may feel tired or fatigued. Your body may try to dilute the excess sugar in the bloodstream by pulling fluid out of your cells. This can leave you feeling dehydrated and thirsty. Most importantly, over time, exposure to high blood sugar levels can cause damage to vital organs connected to the bloodstream, such as your eyes, kidneys, nerves, and heart. If not controlled properly, diabetes can lead to serious complications, such as blindness, amputation, kidney failure, heart attack, and stroke. In order to avoid these complications, people with diabetes must take steps to keep their blood sugar levels in a normal range. One way to do this is through diet. By reducing the amount of carbohydrates you eat in a single meal or snack, you can regulate the amount of sugar entering the bloodstream and prevent your body's insulin supply from becoming overwhelmed. This may mean limiting high-sugar foods such as cake, pie, candy, and soda. You know which ones. Another way to regulate blood sugar is through exercise. Physical activity makes your body's muscle and fat cells more receptive to insulin. In other words, those muscle and fat cells that wouldn't open before, now they will. Finally, your doctor may prescribe oral medications to increase your supply of insulin, regulate the amount of sugar entering the bloodstream, or make your body's cells more receptive to the insulin your body is producing. In some cases, insulin shots may also be necessary. Okay, let's review. We've talked about what diabetes is, a condition where either the body does not produce enough insulin, or the body cells are not receptive to the insulin being produced. We've seen what complications can arise from it, such as fatigue, dehydration, and damage to vital organs. Finally, we've discussed ways to manage it through diet, exercise, and medication. For more information about your specific health diagnosis and treatment plan, please talk to your doctor.
"15 years of service, more than 40 doctors. The SIHHA Medical Center, Dammam. Quality, affordable healthcare."
When people have diabetes, the body's cells are locked, and the sugar that's in the blood can't enter the cells to give them energy. Since sugar can't get into the cells, it starts to build up in the bloodstream. High levels of blood sugar can lead to the common signs and symptoms of diabetes, including losing weight without trying, urinating more than usual, frequently being very thirsty, hungry, or tired, having blurry vision, having dry or itchy skin, tingling sensations in your hands or feet, and having sores that don't heal well. If your cells can't get energy from sugar, they'll try to get it from other sources. Sometimes they'll get energy from the fat in your body. This is why some people with diabetes lose weight even when they aren't trying to. However, this weight loss usually only happens in people with type 1 diabetes. Many people with diabetes urinate more often than usual. This is because their body is trying to get rid of extra sugar through the urine. Going to the bathroom a lot also makes people very thirsty. Since the sugar from the food you eat can't get into your cells, your muscles and organs don't have the energy they need. This can cause you to feel tired and fatigued. Blurry vision is also common in people with diabetes. This is because a high amount of sugar in the blood actually pulls fluid out of your tissues, including the lenses of your eyes. This decrease in fluid affects your ability to focus properly. In other parts of your body, the decrease in fluid can also lead to dry, itchy skin. Over time, high levels of sugar in the blood can damage the small blood vessels that supply the nerves. This can lead to problems such as tingling, pain, or numbness in the hands or feet. Finally, diabetes affects the body's ability to heal and fight infection. So if you have diabetes, it may take longer for a sore to heal.
"15 years of service, more than 40 doctors. The SIHHA Medical Center, Dammam. Quality, affordable healthcare."
When you hear the word insulin, you may think of a drug taken by people who have diabetes. While this is true, what you may not know is that insulin is one of the many hormones created in the human body. Insulin is important to the body. It allows blood sugar, or glucose, to get into cells to provide them with energy. When you eat, your body breaks down food into glucose in your small intestine. This is your body's source of energy for everything it does, from working and thinking to exercising and healing. Glucose travels through your bloodstream looking for individual cells that need energy. For glucose to get into the cells, it requires insulin. Insulin is the key that unlocks cells for glucose to enter and deliver energy. When insulin arrives, it signals the cell to activate glucose transporters. These transporters pull glucose through cell walls. When glucose moves into the cell, it delivers energy. Insulin is normally produced in the pancreas by specialized cells called beta cells. When glucose enters your bloodstream, the pancreas matches it with the right amount of insulin to move glucose into your cells. In people with diabetes, this process doesn't work as it should. In type 1 diabetes, scientists believe the body's immune system mistakenly attacks and destroys beta cells in the pancreas. A person with type 1 diabetes loses the ability to produce insulin. In type 2 diabetes, the pancreas is not producing enough insulin to meet the body's needs. Over time, the amount of insulin typically becomes less and less. In some type 2 diabetes patients, cells build up a resistance to insulin. Even though there may be insulin in the bloodstream, it is not enough to unlock cells to allow glucose to enter. As a result, it takes more insulin to find the right key to unlock the cell for glucose. This makes it more difficult for cells to get the energy they need. When glucose can't get into cells, either because there isn't enough insulin or because the body is resisting it, glucose begins to build up in the bloodstream. As a result, all that energy is wasted. It does not get to cells where it is needed. Without glucose in your cells, they lack the energy they require to keep your body working. To keep glucose from building up in the bloodstream, an external supply of insulin may be needed. Because people with type 1 diabetes can't produce their own insulin, they must inject insulin several times every day or receive insulin through an insulin pump. Many people with type 2 diabetes take insulin too. Injected insulin acts on glucose in a similar way to insulin the body would produce if it could. Like the body's insulin, injected insulin helps reduce the amount of glucose in the bloodstream by getting it into cells where it is needed for energy. Possible side effects may include blood sugar levels that are too low, injection site reactions, and allergic reactions, including itching and rash. Tell your doctor about all other medicines and supplements you are taking because they could change the way insulin works. Glucose monitoring is recommended for all patients with diabetes.
15 years of service. More than 40 doctors. SIHHA Medical Center, Dammam. Quality, affordable healthcare.